Hello, my name is Rosalind Byrd. I'm currently an MD and PhD student at Emory University School of Medicine, and it's my pleasure to present Reducing COVID-19 Disparities via Vaccine Clinics at Black Churches. Before we begin, it's important to mention that this project was started after conversations we had with a member of our own community. She's a Black woman, she's older, and was considered an essential worker, but was having difficulty accessing the vaccine. The partnerships that we developed for this project, we developed as a direct result of our search for community resources to help get her vaccinated. Throughout the pandemic, racial and ethnic minority groups have been disproportionately impacted by COVID, with an increase in hospitalizations and mortality, particularly early on in the pandemic. Development of safe and effective vaccines have reduced poor outcomes. However, even after vaccines became widely available, vaccination of minority groups continued to lag. Structural inequalities such as health literacy, transportation, healthcare access technology, and historical medical and scientific abuses left groups especially vulnerable to COVID-19, but also contributed to disparate rates of vaccination. Thus, it stands that reducing disparities related to COVID-19 must entail targeted approaches to address these issues. Our aim, subsequently, was to verbally address concerns and to facilitate vaccine uptake amongst minority members of the community. Our initiative entailed a partnership between three entities: Emory University School of Medicine, Fulton County Board of Health, and predominantly Black churches throughout Atlanta, Georgia. 2 medical students served as coordinators and recruited 26 medical student volunteers to administer vaccines at the clinics. The majority of students came from backgrounds underrepresented in medicine. We had 3 students that identified as Asian, 19 who identified as Black or African American, 1 who identified as Hispanic or Latina, and 3 who identified as white. Many of us volunteered on multiple occasions. Training on vaccine administration was provided by Fulton County Board of Health Medical Services, and supervision was provided by members of the African American Women Collaborative, a collective of approximately 90 Black women physicians at Emory University School of Medicine. Over the 12 days that we operated mobile vaccine clinics at the churches, we vaccinated 780 members of the community. That's an average of 65 vaccines administered per day, with our highest single day total being 126 vaccinations distributed at one church on a single day. Overall, our initiative was successful because as students from underrepresented backgrounds, we were able to leverage our cultural familiarity to build trust, provide education, and address fears. We engaged in conversations with those who were seeking vaccines and also those who accompanied them. Even those who came just to support loved ones were able to ask questions. So even if they weren't vaccinated that day, they were able to interface with someone that can mitigate their concerns. As we look to the future and consider that future pandemics will also likely necessitate mass vaccination efforts, the success of this partnership can serve as a model to inspire collaboration between community organizations, public health entities, and academic institutions. Thank you.